First of all, I would like to thank the organizers for letting me talk here at the conference. Unfortunately, I'm sick, really sick, so as you can hear my voice, I'm trying to get through this 30 minutes anyway. So let's see. So while we're waiting for the slides, I just got introduced. I'm working at Karolinska Institutet. It's most known for giving out the Nobel Prize, I guess, for the most people around the world. It's a university, a medical university. The things I'm going to talk about you today, it's 3 different kinds of interventions that we actually have developed at KIND and also did some research on it. So that's what I'm going to present for you soon, hopefully. Yes. So I mean, when we talk about people on the spectrum, it's good to have a lifetime perspective. There will be some other people talking about giving out different interventions for the really young ones. I'm going to talk about from 5 years up to 24 young adults. When we talk about ASD treatment, it's really and different intervention programs, it's really, you should bear in mind that the different kinds of training programs you have, they have low to medium effect as an overall. And this is taken from the Cochrane reviews. When you look at the different interventions, you could expect low to medium effect. If you got other training programs where they say, okay, this is really working very well, I haven't seen any of them so far. So the first one I'm going to talk about is emotiplay. Emotiplay, it's a concept with for serious gaming. So this internet-based, and it goes for kids 5 to 10 years old, both high and low functioning kids. And it's built up like I said, a serious game. So it's cartoons in here. I'm going to show you a little bit further on here what it is. But it's a way of training expression, but also how to express not only recognition. This is the new thing about this, where we use different technologies for reading the face or getting feedback from the voice and so forth. I will show you that. This has been a European cooperation between 7 different universities around Europe. And we worked with this for like 4.5, 5 years and building this program from scratch together with Compedia, who is the company who's giving this game out. We had to also, when we do when you're going to put in different things into this game, you also have to know that people actually understand what it is. So we did, for 2 weeks, we recorded with actors, different kinds of emotional activities, from voice, face, and so forth. And we also standardized this through, so we were actually sure that people knew what they were showing here. We also built in a voice analyze that you train the computer so you can get a task, for instance, to sound happy, and you get feedback from the computer. this is just an interface. It doesn't look like that. We build this into different games, so you actually can, when you play these games within the game, so to speak, you get feedback from the computer. This one. So the technology we used anyhow, this should show that, like a face recognition. So you can also get feedback from the face recognition. It should be in a picture here actually, who shows when you do different, like you be happy or angry or something, and what muscles moves in your face. This is really handy when you go and you work with the kids, because you can train on how to look happy and so forth, but you don't have to see your own face. You can have your own character, your favorite character. I don't know who your favorite cartoon can show the face actually. Fortunately, it doesn't work. This is actually the interface. It's about this. It's about this professor and his assistant. So these are the characters within the game. So this should be a movie. It doesn't run, right? So I can talk a little bit more about this. I was supposed to show it, but it actually goes on. You have a curriculum within this game where you actually go from really basic emotions. You train on how you look when you're basic emotion, what muscles you're using, and so forth. And you go gradually to more advanced groupings in different emotional, what do you say, settings. So. And in the game, it's a lot of other games as well, but all the games are about emotions within this game. So you can use this at school. We have used it at school, and we have also used it at a clinic with a therapist, or you can use it at home. So does it work? Yes, it works. In that sense that the kids actually getting better of recognizing emotions, but also to express emotions. We have evaluated this in 3 different countries. We did RCTs around that, and you can read more if you want from these articles if you're interested. Another thing I can say is the EU Emotion Voice Database and the EU Emotion Stimulus Set. That's open, so you can, if you want to do something yourself, there's a validated material. You can go into our website and pick out movies or voices if you want to do some training of yourself. So the problem is with most of these interventions actually are the lack of generalizability. I mean, it's really hard. I mean, you get better at recognizing emotions and also to express emotion, but we have seen also in these different interventions, it's really hard to generalize. So getting the kids to actually get the things they learn from this game outside in the real world, it needs to be more researched on. It's a generalized problem in most of these games, actually.
That's right.
So that was the computer game. The other thing I'm going to talk about now is the KONTAKT. It's a social skills training that has been developed in Germany by Sven Bulte, who's running as a director at KIND. So we have done this into a Swedish version, and you can also do different short and long sessions. When you talk about social skills, we had this discussion the other day, some people, what is social skills? It's a universe of skills. I mean, you can talk of social skills in many contexts, in many different areas actually. So it's really hard to say that, okay, if you do social skills training, you don't actually do all social skills that are around. So we know also that the people on the spectrum sometimes have some cognitive core difficulties, such as social awareness and social orienting and social cognition, social motivation, and also social reward learning. And the purpose of this is also have been shown actually that we think that an implicit improvement by explicit training. So you train this explicitly and then you implicitly get better on this. This is my daughter, by the way. So this social skills training group, it's a group activity with CBT principles and observational learning and behavioral activation, and psychoeducation as a cognitive training as well. So the thing is also with the social skills training, we know that the youth that's been a part of this get better at the social skills that we actually try to teach. But this is also a problem with external validity. I mean, it's easy to get in a group, in an environment that you learn these social skills, but actually bringing that to in real life situations, that's much harder. So when we did this, we looked at the external validity, but we also did try to get some precise and personalized medicine. I think that is something that's going to be more and more useful, or actually really important to get personalized medicine. I'm going to talk a little bit more about that. Though also we did in this some qualitative research, which is also important when you do these interventions to actually ask the participants, did you get better? But also we had a look at the dosage, the intensity. How many sessions do you need actually? So the principles actually in what you do in this group setting, it's really to put the group together with the youth, and you make a very clear structure with an agenda and also with the information and contract, and you also put in the rules. So it should be very, very clear what the rules are and the contract, and also the same agenda all the time. And we do repetition. Get feedback from each other, and you also get feedback from the staff involved in this. We usually have two staff when you run this group, and you have about 8 kids. And different kinds of activities. These are examples that we train on. I won't go into all the details in this, but these are the policies that we have, and also what kind of themes we talk about. I think I can't move it. Yeah, thank you. We also talk about, like I said, we do all different kinds of activities there, like baking cookies and going for a walk, or different activities to get the participants getting out more in the social activities. So we did this, a study. It's kids between 18 and 17 years old. We did a multi-center study, actually, where we had about 413 participants. Everybody had an ASD diagnosed with comorbidity in some psychiatric areas, different kinds. And when we did this, we did some, we had some primary outcome measures. Thank you. It's the social responsiveness scale as a primary outcome. And we had some different secondary outcome measures as developmental disability, SHI global assessment scale, and so forth. This was, we were running this for a couple of years with 400 kids. And how was the outcome? We could see that the short training session with 12 sessions had a little bit of effect, not that much, while as the long one had effect. And also gender-wise, girls had more effect on the training than boys had, actually. And another thing we saw in this was, yeah, you can see here the dosage effect on the long training. You can see with the pre, post, and follow-up. But another thing we also saw that a moderator was also depression. The kids had the comorbidity with depression had much more usage of this training program, actually, whereas the depression went down a lot. We also did some, looked at the copy number variations. This is just to do the precision medicine. So we took spit from all the participants, actually, just to have a look at if they had any copy number variations. And why were we doing that? Yes, it's because the precision medicine I talked about. We had a case, actually, with an extreme negative responder. And he was a boy, aged 12 years old, and he had ASD and anxiety diagnosis. And if we had done this before the training, looked at his copy number variations, then we would never have put him in this group, actually, because he had some duplication syndrome, where the social anxiety is more towards the social anxiety syndromes. That's why. So he started off, you can see here on the numbers, I mean, he was getting worse when he did this. So it's really important, I think, sometimes also to see who are we giving these treatments to, or the interventions. So this boy would never have been in this group, actually. Another thing we did also, I showed you before, where we had the primary measure in the SRS. We, as I mentioned before, it's really important that we also look at the qualitative research when it comes to different kinds of interventions. Everything is not, I mean, when you do this and you put out different kinds of, try to measure different kinds in a quantitative way, you will miss a lot. So we did actually a qualitative one where we asked the responders and non-responders. We saw that, okay, we had non-responders and we had responders. But actually, we had non-responders that actually said that this program has been really helpful for me. I even started going to school. So I mean, we could never see that on the quantitative measures, but when we asked the qualitative measures, we could see those kinds of effects in another way. So the last thing I'm going to talk about, it's something we call transition. This is a program we also developed. It's a support for young adults with neurodevelopmental disorders of different kinds. And the transition, of course, is like emerging adulthood. We know it's a lot of problems for young adults to get into the adult world. I mean, it's a lot of things that are expected of you. And in Sweden, we have an employment rate for people with on the spectrum, but also on neurodevelopmental. It's like 17%, and 24% of all the young adults on the spectrum or with neurodevelopmental disorders, they live with the parents. So the purpose of this was to form a program actually that helped young adults to how you should do, how you can get a job, how you can get somewhere to live and so forth. That was the purpose of this. So it's like a framework. It's a non-formal and voluntary education. It's kind of case management with some behavior therapy and also with acceptance commitment therapy, that where you look at values. What do you want to do with your life? And we have focus on 7 areas in life. It's work and employment, education, economy, independent living, health, participation in society, and social relationships. So we worked as a start. Let's see. It is start like a group-based interventions. Actually, you meet the kid with individual help to start to see what goals he has. What does he want to do? Does he want to go to move from home? Does he have to have a driver's license and so forth? So the participant himself actually pick different areas where he wants us to work with him. So it starts off with a 5-session group-based education. It's different kinds of lectures there. We talk about work and employment, and you get homework assignments in between the group sessions, and we give lectures about economy, health, homework, and also the participation in society. We also get somebody on the spectrum into this group to talk about their transition into adulthood as well. What different kinds of how they made it into the adulthood. It goes on with the 5 group sessions. Then you have individual contact with the mentor for a period of time. So after these 5 group sessions, you have a period of 24 weeks where you work with the individual work with the therapist actually, and you get home assignments and you get different assignments, what you're going to do. So we actually have done a feasibility study on this program, and now we're going to do a larger. We just received money for doing a much larger study on young adults to see, and we got good from the participants. They really liked this program, and we could see also that a lot of them actually managed to get work or get into school or different things they wanted. I just want to say thank you. I hope you understand anything I said. I'm really high fever here and I'm feeling really terrible. So if you want more information, you can go into our homepage or you can mail me and I get you more information. Thank you.